Thank you for volunteering and welcome to the Jefferson Health vaccine preparation video for the Moderna COVID-19 vaccine. Please note these procedures apply to the Moderna vaccine only, not to the Pfizer vaccine. So please familiarize yourself with the similarities and differences between the two vaccines, as they may be both in use at your vaccine site. Please also remind your patients this is the first of a two-shot sequence and does not confer immunity. The second inoculation is due 1 month later, and they should schedule that appointment at the time of their first injection. Even those receiving both shots must continue to wear a mask, observe social distancing and hand washing, and follow public health and Jefferson facility guidelines. The Moderna vaccine is supplied in a preservative-free vial, ready to use, and does not need to be diluted. Each vial contains 10 0.5 ml vaccine doses, although we are authorized to use overfill if it's present in a sufficient quantity to constitute a full 0.5 ml dose. Anything less than that must be discarded. As with all vaccine vials, please do not combine contents of multiple vials, and again, we do not need to dilute the Moderna vaccine. Before we begin to prepare a vaccine dose, let's review some important infection control reminders. Do not vent the vial. Do not batch multiple doses in advance. Do not recap needles. And as always, please observe the infection control imperative of using one needle, one syringe, only one time, and please discard all sharps safely into the sharps container immediately after use. To prepare a dose of the Moderna vaccine, remove a vial from the refrigerator and label with a 6-hour expiration date at room temperature. Don gloves, wipe the vial top with an alcohol swab, and after that dries, using a 1 ml syringe, withdraw a 0.5 ml dose. Administer the dose to the patient and discard all sharps in the sharps container. Please make sure you re-wipe the vial each time you enter. Although wearing gloves to administer a vaccination is not required either by Jefferson Health or the CDC, we are requiring that vaccinators wear gloves for all COVID-19 vaccine doses given, out of an abundance of caution and in the interest of standard practices across all sites and vaccinators. Please be sure to change your gloves before each new patient. Gently invert the vaccine after removal from the refrigerator and between each dose. Do not shake the vaccine vial. To prepare a dose of the Moderna COVID-19 vaccine, swab the vial top with alcohol, and using a 1 ml syringe and a suitable gauge needle, withdraw 0.5 mLs from the vial for each individual patient dose. Please discard empty vials in the waste bins provided. Across our various vaccination sites, we're using 2 different manufacturer products, each of which has multiple lots and expiration dates for the vials we're using. For that reason, it's essential that each vaccinator pay close attention to the lot and expiration date and the manufacturer for the vial that they're using, and be sure to record both on the vaccine information card the patient brings with them. We must also record the time of the injection to determine the observation period. Thank you very much for volunteering and for your attention to this training video.